Brain dead confirmed by brainstem test. Doctors check for the following normal responses for the brainstem test. Hold a light over both eyes to see if they respond to the light. Basically, you can rub the very sensitive eye with a cotton pad or cotton ball to see if it reacts. Apply pressure to forehead and pinch the nose to see if there is a reactive movement. Applying ice water to each ear moves the eyes. A thin plastic tube is passed through the sinus to check for nausea or coughing. Disconnect the ventilator briefly to see if the patient is breathing on their own. After death confirmed, we can ask form the guardians for organ donation. Hemodynamic monitoring values as follows. 1. Mean arterial pressure must between 60 to 70 mercury millimeter. Heart rate below than 100 beat per minute. Best vasopressor is vasopressin over noradrenaline because vasopressin is the recommended first-line agent for vasodilator emergencies associated with stroke. This low-dose vasopressin helps restore blood pressure and treat diabetes insipidus through its antidiuretic effect on the distal nephron. Because vasopressin has the potential to increase blood pressure, regular monitoring of peripheral perfusion is necessary. This is especially true for patients with heart failure. Point 2. If the cardiac index is low, an inotrope like dobutamine should be used. Point 3. Left ventricular ejection fraction at least 45%. Point 4. Urine output at least 1 mg per kilogram per hour. Must insertion central venous catheter and arterial line and measure stroke volume, cardiac output, cardiac index and mixed venous oxygen saturation. These are the main fluid that we use in organ donation patient. Point 1. Crystalloids with balanced salt content are preferred and they reduce hypernatremia. Point 2. Lactated Ringer's solution and half-normal saline 0.45% are frequently used. Point 3. 0.9% saline may cause hyperchloremic acidosis. Point 4. 5% dextrose may worsen hyperglycemia. 5. Hydroxyethyl starches damage renal epithelial cells and causes early graft dysfunction in the transplanted kidneys. Respiratory targets are partial pressure of oxygen 75 mercury millimeter, partial pressure of carbon dioxide 35 to 45 mercury millimeter, positive end expiratory pressure. PEEP 5 to 8 mercury millimeter. Mode: VCV, PCV. Tidal volume 6 to 8 milliliter per kilogram. Mixed venous oxygenation and arterial blood gas. Tracheal or endotracheal tube clearance. Next, thermal management. Prevent hypothermia is due as soon as possible. Target temperature 35 degrees Celsius to 36.5 C degree. If temperature is less than 34 degrees Celsius, must start core warming. Maintain a temperature over 35.8 degrees Celsius before and during the retrieval operation. Active warming should be done using warm blankets, fluid warmers, heated humidifiers in ventilator circuits. Next, hormone therapy. Corticosteroids. High doses of corticosteroids may reduce brain death-induced inflammation and help to modulate immune function, improving donor organ quality, liver, heart and kidney, and post-transplant graft function. It also reduces the catecholamine requirement for maintaining blood pressure. Methylprednisolone should be administered 15 mg per kilogram 24 hourly. Desmopressin. Diabetes insipidus can be treated by replacement of adequate crystalloid solutions and by administration of desmopressin. Vasopressin can also be used as an alternative to desmopressin. Serum sodium less than 155 millimoles per liter. Insulin. Intravenous insulin infusion to maintain blood sugar levels between 140 to 180 mg per deciliter is recommended. Thyroxine. Sick euthyroid, low T3, T4. Routine replacement is not recommended. Some guidelines suggest thyroid hormone supplementation only if impaired cardiac performance is documented despite overall good general management. If you want to know more, you can comment.